Imagine this. A quiet evening in a bustling city, where a woman named Elena sits alone in her apartment, clutching her abdomen as a dull ache pulses through her body. What could it be? A fleeting cramp? Or something more insidious, lurking within? Welcome, dear viewers, to our journey into the world of uterine fibroids, those silent intruders that affect millions of women worldwide. Today, we're not just listing facts. We're weaving a tale of discovery, resilience, and empowerment. So, grab a cup of tea, settle in, and let's unravel this mystery together.
You curious about health? Hell, wanna learn without the stress? Hell, welcome to Cartoon Clinic.
Our story begins with Elena, a vibrant 35-year-old teacher who's always been the picture of health. She loves her morning runs, her classroom full of eager kids, and those weekend hikes with friends. But lately, something's off. Her periods, once predictable and manageable, have turned into torrents. Heavy bleeding that soaks through pads and hours, leaving her exhausted and anemic. "Why me?" she whispers to herself one night, staring at the ceiling. Have you ever felt that way? That nagging sense that your body is betraying you? Elena ignores it at first. After all, aren't periods supposed to be a hassle? But then come the other signs, a constant pressure in her pelvis, like an invisible weight pressing down. Frequent trips to the bathroom, even when she hasn't drunk much water. And oh, the back pain, sharp and unrelenting, making her wince during story time with her students. Sex with her partner? It becomes painful, a reminder that something's wrong. Constipation creeps in, and she starts feeling bloated, as if her belly is swollen beyond reason. Elena wonders, is this just stress from work? Or could it be cancer? Little does she know, these are classic symptoms of uterine fibroids, also known as leiomyomas or myomas. Picture the uterus, that pear-shaped organ where life begins as a smooth, muscular haven. Now, imagine benign tumors, non-cancerous growths made of the same muscle and fibrous tissue, sprouting within or on its walls. They can be as tiny as a pea or as large as a melon. Sometimes even multiple ones clustering together like uninvited guests at a party. And here's a startling fact. Up to 80% of women will develop fibroids by age 50, though many never even know they're there because they're asymptomatic. But for those like Elena, they can turn daily life into a battlefield. As Elena's discomfort escalates, she finally books an appointment with her gynecologist. Walking into the clinic, her heart races. The doctor listens patiently, nodding as Elena describes her ordeal. A pelvic exam follows, gentle pressure to feel for any abnormalities. Your uterus feels enlarged, the doctor says. Next up, an ultrasound, that familiar wand gliding over her belly, revealing shadowy masses inside. For confirmation, perhaps an MRI or a hysteroscopy, a tiny camera inserted to peek directly into the uterus. Diagnosis, uterine fibroids. Relief washes over Elena. It's not cancer. But questions flood her mind. Why me? How did this happen? Let's dive deeper into the causes, shall we? Scientists aren't entirely sure what sparks fibroids, but hormones play a starring role. Estrogen and progesterone, those key players in the menstrual cycle, fuel their growth. That's why fibroids often appear during reproductive years and shrink after menopause when hormone levels drop. Genetics whisper in the background. If your mom or sister had them, your risk climbs. Race matters too. Black women are 3 times more likely to develop fibroids, and they tend to be larger and more symptomatic. Other culprits? Obesity, which boosts estrogen production, a diet heavy in red meat and low in fruits and veggies. Vitamin D deficiency from too little sun, even starting periods early in life. It's like a puzzle where lifestyle and biology interlock. Back to Elena. Armed with knowledge, she explores her options. Not every fibroid needs treatment. If they're small and silent, watchful waiting suffices, with regular checkups to monitor growth. But Elena's are causing chaos, so action is key. First line, medications. Over-the-counter pain relievers like ibuprofen tame the cramps and reduce bleeding. Hormonal birth control, pills, patches, or IUDs can lighten periods and shrink fibroids by regulating hormones. For more punch, GnRH agonists like leuprolide mimic menopause temporarily, starving the fibroids of estrogen. But side effects? Hot flashes, bone loss, not ideal long-term. Uterine Fibroids. Myomectomy, removing just the fibroids while sparing the uterus, appeals to her, especially since she dreams of having kids someday. Imagine skilled surgeons, perhaps using laparoscopy with tiny incisions, excising those growths like pruning a garden. Recovery? A few weeks, but fertility preserved. For those done with childbearing, hysterectomy, removing the uterus entirely, offers a permanent fix, though it's major surgery with emotional weight. Am I ready to say goodbye to that part of me? Elena Bonders. Then there are minimally invasive wonders. Uterine artery embolization. A catheter threads through the groin, injecting particles to block blood flow to the fibroids, causing them to wither. No incisions, quicker recovery. Sounds sci-fi, right? Or MRI-guided, focused ultrasound. High-energy waves zap the fibroids from outside the body, guided by real-time imaging. Innovative, but not for everyone, depends on fibroid size and location. As Elena chooses myomectomy, we pause to reflect on the broader impact. Fibroids don't just affect the body, they ripple through life. Heavy bleeding can lead to anemia, sapping energy and focus. Pelvic pressure might mimic pregnancy, drawing unwanted questions. Infertility? Fibroids can distort the uterus, blocking fallopian tubes or impeding implantation. During pregnancy, they raise risks of miscarriage, preterm birth, or cesarean needs. And the emotional toll, frustration, isolation, even depression. Yet, stories of triumph abound. Think of celebrities like Tia Mowry or Sarah Bareilles, who shared their fibroid battles, sparking awareness. Post-surgery, Elena emerges stronger. Her periods normalize, pain fades, and she reclaims her vitality. But prevention? That's the proactive chapter. Can we outsmart fibroids? While not foolproof, lifestyle tweaks help. Maintain a healthy weight through balanced diet and exercise. Load up on greens, fruits, dairy for their protective nutrients. Vitamin D supplements if you're deficient. Limit alcohol and caffeine, which might exacerbate symptoms. Regular checkups catch issues early. And for those at high risk, discuss options with your doctor. As our tale nears its end, picture Elena back in her classroom, radiating energy. She's not just survived, she's thrived, turning her experience into advocacy. Sharing her story with friends, urging them, listen to your body. Don't dismiss the signs. And you, viewer, if this resonates, consult a healthcare pro. Knowledge is power. Thank you for joining this exploration of uterine fibroids, a story of hidden challenges and heroic recoveries. If you face this or know someone who has, drop your thoughts in the comments. Hit like, subscribe for more health tales, and remember, your body is a storyteller too. Listen closely.
Or click subscribe, come take a peek. It's smart, it's fun, it's cartoon.